This is Casey Quarter. I'm going to be going over what CPR is. So CPR combines chest compressions with artificial ventilation, and the goal of CPR is to preserve brain function. To use it, we're going to use it on a patient who's unconscious and is not breathing. So the three things that you're going to check first are going to be your airway, circulation, and to see if the pet's breathing. This really shouldn't take long because you need to go fast when you have a pet that's in need of CPR. So what I'm going to do is I'm going to put my hands like this, one hand over the other. I'm going to make my elbows straight, and then I'm going to lean from the waist. So the pet's going to be in lateral recumbency, and I'm going to go like this, and then I'm going to lean on the pet and give it time for the chest to come completely back up, and then down, up, down, up, and I'm going to be giving a breath every 6 seconds. If you are alone, you can do it every 30 seconds if you need to do mouth to snout, or if someone's there, they can give a breath either with an ambu bag or an anesthetic machine, depending on the condition of the patient. So it does change based on the breed of the patient. So if I'm going to have like a large round-chested dog, I'm going to go for the last ribs to the highest point of the chest, and that's where my compressions are going to be. If it's going to be for a keel-chested or a small dog or a small cat, it's going to be over the actual heart, and to find that, you move the elbow back to find where the heart would be, where the elbow meets the chest. That's generally where the heart is. And then a flat-chested dog, it'll be over the sternum. So the drugs that we have available at our discretion when we have a pet that has is in need of CPR, we have glycopyrrolate, epinephrine, and atropine. At my clinic, we have emergency drug calculators that are printed up and with every patient that goes under anesthetic, and it shows us our doses of atropine, epinephrine, glyco, lidocaine if we need it, anything that would be considered an emergency. So the rate that I'm going to do is I'm going to do 100 to 120 beats per minute with 6 breaths per minute. I'm going to compress the chest at least half to 1/3, and then if I don't have the patient intubated or I can't intubate, I'm going to do mouth to snout resuscitation, so that I'm going to close the mouth and then breathe through the nose. As far as the difference between trauma versus a patient under anesthetic, generally a patient under anesthetic is going to be hooked up to monitoring equipment and is going to be usually already intubated. So we have our ECG leads that we want to hook up, blood pressure, SpO2, capnograph that's attached to our anesthetic machine, and of course I have my ET tube and my laryngeal scope in the event that I have to intubate this pet as soon as I can. So what I'm going to do now is I'm going to pretend to do CPR on Lamb Chop here. So I have him in lateral recumbency, hand over hand, and I'm going to do this for 30 seconds. And then every 30 pumps, I'm going to give a breath. So I'm going to put the ambu bag in Lamb Chop's mouth.
I told you I was already tired. I'm just